Hey everyone, it's Jaclyn here, doing my July entry for my video blog on mental health from an East Asian perspective. A lot has happened this month, and I'm not going to go into it for the entry now, but what I will say though is that, and this is also a reminder for myself, is that I think we need to remember that we're all human. And so being human, we make mistakes, we have feelings, we say things that we may not mean and regret, we feel guilt as well. And I think from a relational standpoint, remembering that all of us are human is critical to how we communicate, how we engage with one another. So for myself, who does not and is not diagnosed with mental health issues, looking at and interacting with someone with mental health issues, it's not something where if I label them with mental health issues, they'd be pathologized, so they would be considered sick or that there's something wrong with them. But if we look at them from humanized or think about them as a human, we realize that they also have very similar needs as myself. And that's something I feel could possibly be a step towards how we treat folks with mental health issues, especially since in the East Asian community, we look down on people who are sick, and although we have some methods to address those issues, I still think that we treat folks with folks with mental health issues as some sick person, and that they're inferior and that they need something. So when I think about them needing something, for someone who doesn't have mental health issues, we're not exactly sure what they need either. And for us, it's more about listening and gauging what they need, and also rather simply being there for them. Since we also need to back off and not assume that we know more than them, because that also, in some ways, is a counterintuitive act of helping them, in the sense of encroaching their space and lecturing what they should be doing, when really we should be also giving them space to find themselves and seek help. And although it's very painful to, or at least for me, it's difficult to just stand by and not help, I think that is also an act itself, to be on standby and to remember that they're human and that they have emotions and going through very similar things that folks with no mental health issues have. So yeah, that's my bit for now.